My name is Erica. I am a licensed massage therapist who focuses on womb health. I'm fascinated with all things that have to do with the womb. I discovered Dr. Seher on Instagram and am so fortunate that she's located here in Denver as
Mm.
well. So I went to see her for my own pelvic floor health and curiosity and learned all the things. She's an incredible pelvic floor therapist. I actually also sent my husband to see her, and he also is a huge fan. So I am very, very excited to have her here, and I'm gonna let her take over.
Thank you, Erica. You're so sweet. Also, Erica's a wonderful massage therapist. I got my womb massaged by her, and it was very lovely too. So I'm a fan of you too. A little bit about me. So I'm Seher. I have my doctorate degree in physical therapy. So at the end of the day, baseline training of physical therapy, and then I specialize in the pelvic floor. So a lot of what I do is centered around just the pelvis and then the pelvic floor muscles, which if you've never heard of what that is, we can kind of dive into it in a little bit. And I'm going to share my screen in a second. But basically, to become a pelvic floor PT, you just become a regular PT first, and then you just take a whole bunch of certifications, and then you can either become obsessed with it or you can dabble in it. And I chose to just be super obsessed with it. So I opened up my practice. I am served the Denver area, but my office is located in Lakewood. And yeah, I primarily focus on pelvic pain conditions and some of the stuff that we'll kind of dive into in a little bit. Feel
But
free. Yes.
do you also, I feel like I saw on your website, you can do virtual meetings with people who aren't located in Denver.
Yeah. Yep. So virtual is an option too. So there's like some legalities where when it comes to like treating people from out of state. So we would just have to um it's coaching. It's more like I give you information about your pelvic floor and I help guide you, but we can't really call it physical therapy. So a lot of times with the virtual people, I'll still help them, but then I might find them a local PT around them in the area and refer them out or something like that. So yeah, virtual stuff is an option too. Thanks, Erica. And then I'll go ahead and start sharing my screen and show the presentation. Once the presentation starts, I just keep going. Please interrupt me if you have any questions, and then we can maybe I can answer some questions at the end. I just want to give you guys a general overview of what the pelvic floor is and just like inspire you to just connect with that region more and maybe just think about it more often. Okay, I just sent you a request to share. Perfect. And then this is what we do. Okay, cool. My really messy desktop. Ignore the mess. What do I do? Slideshow. Okay, cool. All right, friends, let's do this. Okay, so pelvic care. I just want to give you guys a little disclaimer that I will be using the word vagina and sometimes might even say the word penis every once in a while. So, just getting that out the way right now. If you're in a place where you don't want people hearing those words, get to a comfortable private place. But also, these words are not bad words, they're not dirty words. So, yeah, we're just gonna say them. Okay. So, first question is, what is the pelvic floor? And believe it or not, we all have a pelvic floor, but this is not common knowledge. So, here is a model of the pelvic floor, an illustration of it. And right here, this is the anatomy of someone with a vulva, but everyone has a pelvic floor. Just if there is a penis here, what happens is this muscle right here just wraps up. But other than that, it's pretty much the same exact muscles. They do the same exact thing. This is the external view. And then this is the view if you were like looking inwards towards the pelvic floor from the top of the pelvis. And this is what the muscles look like. They attach from the pubic bone all the way to the tailbone. It encompasses the entire pelvic bowl. So your entire hips, like inside of your hip cavity, are these muscles, and their job is to support the pelvic organs. So that's like the main thing that the pelvic floor muscles are known for. They're there to support your uterus if you've got one, your bladder, your rectum, your prostate if you've got one, and just be a supportive floor for your abdominal viscera and organs. And this is just another view of the pelvic floor, just showing you like male and female anatomy. Here, it's literally the same exact muscles. They're kind of color coded to match. And the main difference is literally like this muscle right here. Instead of there being a hole, like in people with vaginas, there is actually like not a hole, which actually makes it so that women are usually more prone to pelvic floor stuff just because we got two holes instead of one, you know? So there's just more of a just potential for weakness when there's a hole going through a bunch of muscles, right? So this is what it looks like. And then what does the pelvic floor do? So I love this little diagram that kind of just breaks it down into 7 functions. So first function is pelvic organ support. These muscles are holding up your organs. And then second function is going to be anything relating to bladder and bowel control. So holding back urine, holding back gas, holding back bowels, and also letting it go too. So like sometimes if you have a lot of pelvic floor tension, it's going to be hard for you to empty your bladder. Like you might have to really push and press the urine out, or you might be constipated. Those are all examples of pelvic floor issues. And then I'm trying to like also see myself. um wait, it says 4. That's so funny, but there's no number 3. That's wild. Okay, another one is passing of urine and feces. Guys, I have given this presentation so many times and I never noticed that number 3 is missing on this little diagram. That's so funny. Anyways, passing of urine and feces, which I already talked about. There's a big sexual component of it. So really your pelvic floor is what allows you to enjoy sex, enjoy intercourse, enjoy orgasms. If you have a hard time getting to orgasms, it could be a pelvic floor issue. And then breathing is a big one. We breathe over 20,000 times a day, and with each breath, your pelvic floor is supposed to move with it. And that's like a huge, huge function. And today I'm going to talk to you all about how to breathe with your pelvic floor properly. Because yes, we all know how to breathe. We do it all day long, but we're not always breathing in a way that supports the pelvic floor. And then the other function is pregnancy and childbirth, according to this diagram. But I wrote a couple extra things in my little bullet points. So role in anticipatory postural control during movements. So your pelvic floor muscles are the deepest muscles that help stabilize your spine and your hips and really your whole body. So they are the first muscles that have to kick on. My gosh, my cats are making a mess. They're the first muscles that have to kick on whenever you need to like stabilize your core or control your posture anytime you move. So they're just like automatic muscles that you don't have to think about. And because they are the first muscles to kick on, they are just more prone to being overused and like having tension, trigger points, things like that. The other big, big function of the pelvic floor is pressure management. So anytime you have to cough, laugh, sneeze, lift weights, transition from like a sitting to standing, all of that increases the pressure in your abdomen, and your pelvic floor has to manage that. And typically it's a mismanagement of that pressure that causes urinary leakage. So we can talk about that a little bit later too. And then I already kind of mentioned it, but sexual activity and orgasms is going to be a huge one too. Cool. Okay, so let's talk a little bit about what pelvic floor dysfunction might look like. Now, a lot of you tuning into this might notice that you might have experienced like one or more of these issues, and that's like completely normal. You just don't want it to become like a repetitive issue over time that persists. All of these are things that can be worked on, but it's very common that you might experience this at one point because the pelvic floor responds to stress, anxiety. It responds to like whatever you ate that day, where you are in your cycle, things like that. So first of all, painful intercourse is going to be a big one. So if intercourse, so penetrative sex or just any other form of sex is painful, that's something that you want to make sure that you're taking care of your pelvic floor because that's something you can work on. Any type of issue with like initiating streams. So if you feel like you're pee shy or it's difficult for you to empty your bladder or you feel like you have to go constantly in small quantities, that's typically a pelvic floor issue. Overactive bladder, this is when you feel like you need to pee all the time, like maybe every hour. Normal urinary frequency, you want to be able to hold it if you needed to, but normal frequency is like every 2 to 4 hours, even if you're drinking a lot of water. So something to just think about if you feel like you're like a person that just pees all the time because you're bored, you work from home, things like that. You can end up training your bladder to being a little bit more sensitive. So we don't want to do that. um Leakage or incontinence, any type of leakage is not considered normal. It's super common, so there's no shame. But there's this common belief that it's normal, especially after having kids. But I treated a woman once who literally had 11 kids, 11 vaginal deliveries, and she was a runner, and she was like 60 years old, and she no longer leaked after we worked together for a few sessions. So just know that it's common, but it's not normal, and it's something that we can work on, which is a great thing. Like, we don't have to go our lives peeing our pants after having a child, you know? And then you might find, so if you're tuning in and you're like, well, I've never had kids and I still pee my pants when I cough, or like I still pee sometimes when I run. It is something that can happen. Like, urinary leakage can be a result of the pressure management issue, or it can be like too much tension too. So often I will see like young girls, young women, or athletes, young athletes who have urinary leakage issues, and it has nothing to do with weakness or having kids. Okay, the other thing is pressure control issues. And then I wrote down against gravity or like with gravity. So what that means is maybe like by the end of the day, your muscles are so fatigued that you feel pressure in your pelvic floor. You feel like the organs are like, maybe you might not know what it is, but it could be like the organs are descending down a little bit. And that's something that, again, you want to work on pressure control, and you want to work on just giving those muscles a break, which we'll talk about in a little bit too. And then this other bullet, organ prolapse. If you don't know what the word prolapse is, you will learn about it at some point in your life, because it's just a common thing that affects women. Pelvic organ prolapse is when the organs, again, are just not supported very well. So they're kind of like dropping down into the vaginal walls. And there's different grades to it. So if you Google it right now, you're going to freak out and think it's like this horrible thing, but it's super common. There's different grades to it. A grade 4 is one that you can't really do much about and can repair, but for the most part, you can be asymptomatic with a little bit of the pelvic organ prolapse. And then in general, after childbirth, don't get me wrong, like giving birth, that's what the pelvic floor knows it's supposed to do. Like, it's like a thing that not supposed to do, but it's something that it can do. It's part of its function, but it still puts the pelvic floor at risk. So there's going to be higher risk for that prolapse that we just talked about. There's going to be just, if you have kids, whether it's C-section or vaginal delivery, you're going to want to take care of this region and gradually return back to life. And I think that's just something that is not always the standard of care, especially in America. So something to just think about. And then there's other dysfunctions that can occur. Sometimes it's just like a combination of all of these things too. It's not just like one thing or another. And if you're noticing there's like pain down there that doesn't sound quite similar to like what's on this list or some other things, there's other things that can happen with the pelvic floor too, especially like with hormones and menstrual cycle too. Okay, so the question I have here, and I know there's only two of you tuning in right now, Tamra and Lizbeth. But Erica already knows the answer to this, I think. But I guess my question is, to Kegel or not to Kegel? Does anyone want to answer?
Not to Kegel.
Not to Kegel. Why do you say that, Lizbeth?
Um, I think it's because many people think that when you're Kegeling, like it's supposed to tighten it, but what if you're already tight and it's just gonna make things worse?
Yeah. Yeah. Good job. That was great. Yeah, so if you follow me on Instagram, you might have seen me like post about this because if you follow any pelvic floor PT on Instagram, they're going to talk about how you should stop doing Kegels. So Elizabeth is right. To Kegel or not to Kegel, a lot of us are already carrying tension. So if your pelvic floor is already naturally tense and then you just keep doing Kegels kind of for no reason, or maybe because like your grandma told you that's what you need to do, or your mom told you that's what you need to do, there is a potential to make it worse. There's a potential to accumulate even more tension. And sometimes people will give themselves like urinary leakage issues because now the muscles are so tense that they're like not able to relax in order to produce a contraction. So the real answer, though, I will say to this question is it depends. I'm not going to demonize Kegels. They have their place. When I have my clients come in and I'm doing internal work on them, so I'm inside their pelvic floor and I'm checking, I do have them Kegel. I do have them relax. I do have them build the awareness. So sometimes it can be helpful for building awareness, connecting with those muscles. But if you're just like willy-nilly doing Kegels for no reason, it's not always helpful. And if you have existing pelvic issues, like if you have pelvic pain, you have pain with sex, you have constipation, things like that, Kegels are probably not going to be the thing to do. But if you want to like connect with those muscles, it's not a terrible thing. You just don't want to, it's just over prescribed. So it's just a little bit more nuanced than what we would think. And the other thing is when people think of pelvic floor rehab or pelvic floor physical therapy, I think that the thing that comes to mind is Kegels, right? So people are like, oh, like I'm just going to go to your office and do Kegels all day. And that's really not the case. It's actually pretty infrequent that I have people sit there and just do Kegels. We do plenty of other things. The pelvic floor muscles are supposed to work with the rest of your body. So doing ab work, doing leg days, squats, lunges, deadlifts, all of that are things that are more effective for strengthening your pelvic floor than a Kegel would be. But if you have some kind of underlying disconnection with your pelvic floor, or those muscles are not activating the way they're supposed to, or there's like a pressure, again, like I keep saying pressure, but there's like, if you don't know how to like manage pressure in your body, so you don't know how to brace your core properly, then that can make exercises potentially like it can make you feel worse if you have pelvic pain. So those are the things that, not to fearmonger, but those are the things where you might want to check in with those muscles or go to a specialist. Okay, so with all of that being said, what I really have for you guys today in this presentation is just connecting with your pelvic floor and first of all, just understanding what they are and that they exist, but that also knowing that relaxing the pelvic floor is going to be really helpful. So there is such a thing as like building too much tension by doing lots of Kegels and like not taking care of your pelvic floor in the proper way. And of course, there is such a thing as like a too relaxed pelvic floor where it's lacking strength. But for the most part, most people can benefit from pelvic floor relaxation. Like, especially if you identify as someone that's constantly on the go, someone that has tight hips, someone that has like tension in their jaw, tension in their pelvis, you're gonna benefit from relaxation. So this is something that I feel really comfortable just like telling everyone to do. Like, yeah, stretching your hips is probably good for your pelvic floor and is gonna be good for you. So with this slide, just keep in mind that your pelvic floor can only contract as much as it can relax. So if your pelvic floor is already tense and it's here, and then you ask it to contract, it's going to be a weak contraction. But if your pelvic floor can relax fully and then contract fully, it's going to be a lot stronger. So you want to make sure you have range of motion. Most people, especially people that maybe haven't had kids, young people, it's typically a tension issue, like from just what I see. Inability to relax the pelvic floor leads to weakness. Yoga stretches, if you're into yoga, pigeon pose, happy baby, malasana, which is this yogi squat right here. All of those are going to be super great for your pelvic floor. So one thing you can even start doing today if you want to get started on just working on your pelvic floor is honestly take a yoga class, like take weekly yoga classes. I'm biased. I'm a yoga teacher. I know Erica's a yoga teacher too, but I literally also believe in yoga. Like that's why I teach it. Take a yoga class if you can. And that's like a fun thing you can do once a week indefinitely just to make sure you're taking care of your body and your nervous system. Deep 360-degree breathing. So this one's a huge one. So we'll talk about breathing again, I think in the next slide. But when I say 360 degrees, we're talking about when you inhale, your rib cage should expand front to back and side to side as opposed to up and down. And most people breathe vertically where they inhale and they suck in, and that actually creates pelvic floor tension. And I honestly have to spend a lot of time with clients who have tension in teaching them how to stop sucking in their belly and to start breathing in a more expansive way. So that's a huge one. So you can get into any of these positions, yogi squat, happy baby, pigeon. You can just lay down on your back, kick your legs up a wall, and you can just practice putting your hands on your rib cage and just breathing in a more outward expansive way. And that would be really great for your pelvic floor. Um, Also stop sucking in your belly 24/7. We live in a society where we have high-waisted leggings and tummy control and all of that. If you're able to, like when you get home, like just wear loose clothing, chill, let your belly hang, relax, because like even right now I'm wearing high-waisted leggings, right? And I'm sucking in. Like I'm it's just like a natural thing we're just doing all the time, right? So something to pay attention to. And then soft tissue mobilization is going to be great. So what I mean by this is you can grab a tennis ball, a lacrosse ball, you can take a foam roller, and you can just have a seat on it. Like just sit on it underneath your sits bone and just melt your pelvic floor and just breathe into it and just close your eyes and just relax and connect with releasing those muscles externally. You can also release your glutes. You can work on releasing your inner thighs, really anything surrounding the hip. If you release those muscles, it's going to help indirectly work on your pelvic floor. So these are just like more like external ways, indirect ways to get in there that are like just can be part of your gym routine. And then I wrote down that it usually takes 90 to 120 seconds for muscle tension to release. So once you find a spot that feels a little tender, you just want to like relax into it and hold it for about 90 seconds. Okay. That's instead of just like rolling constantly, you want to give muscles a chance to adjust to the pressure that you're putting on them. And then this last bullet is relaxing your pelvic floor isn't going to make you loose. Um, yeah, like there's a myth that vaginas are loose. It's not common. I mean, don't get me wrong, if you have like a lot of babies, like you're at more risk for like weakness, laxity, loosening. If your genetics are that you're super hyper mobile or you have like a connective tissue thing going on, it is common. Not common, it is possible that you can have a loose pelvic floor. But if you're just like just chilling, going about life, haven't ever even had a kid, and you're just an anxious person, you're probably more tense than you are loose. So just keep that in mind. Also, needless to say, the number of sexual partners you have, it's not going to make you loose. Just like a penis doesn't have that power, right? Like our pelvic floor muscles are strong. They stretch, they expand, and then they bounce back. So yeah, that's just like another one that like a myth that women have been fed our whole lives is like, if you have sex with so many people, you're just loose and like blah, blah, like all of these things that are just really just putting shame on women. And if anything, that shame is going to make you more tense than loose anyways.
Oh, my
So
grandma was. She was always telling us stuff like that.
your grandpa?
No, my grandma.
Grandma.
She would tell us, don't let boys touch your breast because then your breasts won't grow. I was like
That's
11.
crazy. I feel like if anything, the blood flow would make them grow better. That's funny. But yeah, I mean, I'm Turkish. I grew up in Turkey where I grew up like under like a really religious like household, I guess. And I was just told like you're dirty if you like let anybody touch there and things like that. And I just remember being in high school and this is so crazy. I remember being in high school and I remember like there were some girls that, like had sex with multiple people like in high school. And I remember hearing guys say, "Oh, she's loose." Like, "Oh, she's been around," like talking so much shit. But I look back now and I'm like, there's no way a freaking 16-year-old girl is loose. Like, I just don't see that happening. Like, it's just not a thing. So yeah, that's my little rant about that. Okay, so now we'll talk about breathing. So if you're able to really look at this diagram and digest it, like pause the video, look at it, it'll help your brain kind of connect. Let me see if there's another diagram. Yeah, this one's nice too. So basically what you want to think about is your diaphragm. Your diaphragm is your breathing muscle, is right under your rib cage, right? And then you've got your pelvic floor at the very base of your pelvis. Every time you inhale, your abdomen should expand outwards and everything should expand outwards. And then this gives the pelvic floor and the organs a chance to like have room to move downwards. So every time you inhale, your pelvic floor actually drops down and it relaxes. And every time you exhale, the abs naturally contract inwards and the pelvic floor lifts up. This concept is very confusing for a lot of people. When I first learned about this concept, I was confused. I was like, what are you talking about? When we inhale, like that's how you do a Kegel. But it's actually the opposite of what you might think. It's inhale to expand and to relax. It's exhale to engage. So if I were going to have you do some Kegels right now, just to connect with that muscle, I would want you to inhale, relax, exhale, squeeze the muscles of your pelvic floor up. Okay. So it's always on the exhale. So if you are confused about that, I would say, hey, take a moment later to just breathe and connect with your pelvic floor and maybe do like 10 Kegels and see if you can coordinate them with the breath just to connect, right? Not to like keep doing Kegels and to like create tension down there, but inhale, relax, exhale, engage. And I like this little diagram too, because you can see here that the diaphragm and the pelvic floor are both dome shaped and they're just opposite. So when you inhale, diaphragm drops, pelvic floor drops and relaxes, abdomen goes outwards. Look at all these arrows. And then when you exhale, diaphragm lifts back up, pelvic floor lifts back up, and the abs draw inwards. Okay. So I wrote it down again so that you can look at it, right? Inhale equals relax, exhale equals contract. This is naturally, ideally happening naturally where you don't have to really think about it. But if you want to connect with the pelvic floor, or if you do have existing pelvic floor issues, breathing is step one. Just work on your breathing and work on understanding how to relax on the inhale, and just know that it's a very subtle sensation. So you're not going to like feel like a dramatic thing down there, but if you were to like put your finger in your pelvic floor and you were to breathe, that's one way to connect with that. Lisbeth, you turned your camera on. Do you have a question or anything, or are you just more
No, I
present
just
now? Here now. No question?
no.
Okay, cool. Thanks for turning it on. It's nice to see your face. Okay, so more on this same little soapbox I'm on. So this slide, whoops. Ah, how do I take me away? Oh no. Wait, what happened? Uh,
We can
hold on.
still
I gotta
see.
share my screen. Share my screen again. Okay. La la la. Your screen sharing is paused. Can you
Oh,
guys see this?
yeah, we can see it. It says diaphragm,
Oh,
transverse.
you can see it? I can't see it. That's so weird. What do I do about that?
Uh,
Okay, sorry.
I
Okay,
did
my
it.
bad, y'all. So same thing. So diaphragm, right? Pelvic floor, and then transverse abs are your deep, deep core. So another thing I want y'all to know is whenever you engage your abs or you do core work, your pelvic floor needs to engage with it. So what that means is if you are doing ab work and you're constantly pushing down on your pelvic floor and your pelvic floor is bulging out, that's pressure mismanagement. That's not what we want to do. We want to pretty much, our body naturally kegels, it naturally lifts up without you knowing anytime you activate your abs. Okay. So this is just a concept I want you to just know about. Whenever the abs relax, the pelvic floor relaxes. Whenever, or that's the relationship that we're supposed to have. It's not always the case. And whenever the abs engage, the pelvic floor is supposed to engage too. Okay, so a couple more things. I think this is super interesting, so I always like to talk about it. But if you look at this like beautiful little illustration, this is what the vocal cords look like, and then this is what the pelvic floor looks like. This is what the throat, larynx looks like, and then this is what the uterus looks like. And this is not a coincidence. The vocal cords, the pelvic floor, the throat, and the pelvis, they're connected. So when you were being developed in the womb as an embryo, these structures came from the same tissue. And then as you grew, your spinal cord like differentiated, but there's a fascial connection, like a long line of connective tissue that goes from the vocal cords to the pelvic floor, and they relate. So whenever we are anxious or scared, we clench our jaws and we clench our pelvic floor. Like they respond concurrently. Whenever you're grinding your teeth because you're anxious, you're also probably clenching your pelvic floor. When you speak in a high pitched voice or you're angry and you're screaming, your pelvic floor is also engaging. whenever you hum and you relax and your voice goes lower toned, your pelvic floor also relaxes. So something to keep in mind. So you can always do like a humming meditation, like where you inhale and on your exhale, you go and you hum. That can help relax the pelvic floor. Lots of stuff in yoga. Again, just another shout out to yoga. Um, and then just like during intercourse, during sexy time, like making noises can help things feel better because it allows for your pelvic floor to fluctuate. So there's just a lot of good things here with the pelvic floor. And if you wanted to get like spiritual about it, using your voice to speak up for yourself is a good way to also like release tension and shame from your pelvic floor. So we can get real deep with it if we needed to, but I just wanted you guys to see this illustration and know that this is freaking cool. Like this is important stuff. Okay. And then this is just like a vulva, like a vulva picture, right? Vagina is not a dirty word. And just another little disclaimer about just like I mean, I'm a pelvic floor PT. I work with vaginas all day long. I see so many of them, right? And this is just to show you all that like it looks beautiful. It's normal the way it is. And every vulva looks different. And your vulva is not dirty. Your vulva is not ugly. It's not shameful. I don't know what you've seen in social media in like this industry where like, I don't know, we have like women's bodies like are readily available to look at like online and things like that, but that comes with like societal expectations too. So like just knowing that what you see online is probably not real and that whatever you got going on is normal, right? So I love also throwing this slide in there too. And then another one, just to show all the beautiful variations of all the vulvas. The word vulva just refers to the entire like genitals, whereas vagina just means just the whole. And then I think this might be the last slide. Yeah. So the keys to unlocking your pelvic care. You want to develop awareness with your breath and your pelvic floor. You want to have a balanced pelvic floor strengthening and relaxation. So what I mean by this is like, yes, I want you to do the relaxation work. Yes, I want you to do yoga, but also can you lift weights? Can you go to the gym? Can you maybe hire a personal trainer if that's something that you don't feel comfortable with, and get really comfortable with strengthening your abs, strengthening your glutes, strengthening your hips. Other point is expansive rib cage breathing. So breathing where you're allowing your ribs to expand is better than belly breathing, which is better than chest breathing. Okay. Remember, your lungs are in your rib cage. So when you breathe, you want to feel your rib cage expand. And then there's also just like if you want to take care of your pelvic floor, you got to embark on this lifelong quest to let go of shame. We are shamed so often. Whatever your upbringing was, even whether you've had like religious stuff growing up or like cultural stuff that have shamed you, at some point, like women have been shamed, right? To have to like quiet down about their pelvic floor, not talk about their periods, not like express themselves. So letting that go is going to be another part of just like having a healthy pelvic floor. And then vulva gazing and self gazing in a mirror. So if you've never done this, I highly recommend grabbing a mirror, looking at your vulva and just looking at her and gazing and then speaking affirmations. So you could always go into like Chat GPT literally, and you can be like, what are some affirmations for my vulva? And it will give you the best affirmations you've ever seen in your life. So there's so many beautiful things. One of my favorite ones is I let go of all disappointment and hurt from my pelvis. So whatever resonates with you, I highly recommend just like trying to build that relationship with your pelvic floor and your vulva. Okay, I think that's it. Are you guys still seeing my screen or are we good?
No, we can see
Okay,
you, but not
you
the
can see me
presentation.
now. Okay, cool. Well, that's it for the presentation. Thank you. Let me know if you have any questions.
Yeah, actually, you mentioned real brief earlier about how pelvic floor dysfunction could be causing like painful periods or like endo. Yeah, tell us a
Yeah.
little.
Yeah, we can talk about that. So whenever I work with someone that has painful period condition like endometriosis, it's kind of like chicken or the egg, or For some conditions, it's like chicken or the egg. Like, I don't know if it's the pelvic floor that's making your period super painful, or if it's because your period is super painful that your pelvic floor is just tensioned up. But what I can say about it is, like, especially with endo, like, endo is just a condition of its own. And it usually, endo causes pelvic floor issues. But then when the pelvic floor issues are, when your pelvic floor is super tight, it just makes you have more cramps, more pain, because your uterus just doesn't have enough space. So typically with conditions relating to the period, understanding how to release your pelvic floor and relax it, understanding how to breathe, maybe even buying, I didn't have this on the slides, but if you were to purchase a pelvic wand, I can email you all this. If you purchase a pelvic wand, it's a tool that you put in your vagina and you release the muscles yourself. If you do that, that should help with period cramps. That should help with like endometriosis symptoms. It doesn't fix it, but it's all helpful. Anytime you release tension from the abs or the pelvic floor or the glutes, it's gonna hopefully help you with like your menstruation in general. Thanks, Erica. Good question. You guys can always shoot me an email, or yeah, email is better than like an Instagram DM. But
Yes.
I'll follow up with you all and then let me know if you need anything.
Yeah, I learned a lot. Thank you. I didn't. I was over here practicing my breathing while you were talking, so.
Good. I'll I'll send you all a follow-up email with just like some exercises, some things to work on too. But yes, if you can just breathe and focus on your pelvic floor, that's like honestly step one. So I'm glad you're doing it already.
Well,
Okay,
thank you,
perfect.
ladies.
Have a good
Cheers.
night.
Night.
Bye.
Bye, Erica. Thanks for
Bye.
having me.